Okay, so I know y'all probably looking at the title like, girl, I thought you already found a doctor. What happened to the last video? By the way, I'm eating Cheez-Its. I'm freaking starving, y'all. I'm really gonna have to work this out later. I've been doing my thing, eating right, working out. So far, I lost, I think, 5 pounds in 1 week. So, yeah, I've been trying to be good. But anyways, back to the story. I know y'all probably think I found my doctor. I really like that doctor during the last video. Me too. But let me give you the tea, honey. So I came home from the appointment. As I stated, I need to talk to my mom, like see what my mom is thinking, because I need mom on board. So she's like, you know, do your research on the doctor specifically, go on Sunbiz, look at the doctor's reviews. I'm like, bruh, really? Like, I just can't pay the doctor, schedule my surgery. Like, I'm tired of looking. At this point, y'all, I'm tired of looking. So she's like, Simone, do what you want, but I said what I said. That's basically what she said. So I'm like, let me just do it, just to do it. Y'all, I looked at that doctor reviews, honey, I wanted to fall out. Not all of it was bad. Most of the people were complaining about the facility and how their timing is off. As I told y'all, when I came in, I waited hours before I was seen by the doctor. But it seems, according to the reviews, that that's normal for that facility. Like, everyone was complaining about how long it took. Like, when I went to sit down, a couple of the women, got there at 9 a.m. A couple of the women had surgery scheduled at 7 a.m. and still weren't on the OR table. Or the OR, in the OR on the table. Yeah. I'm like, okay, obviously this is a pattern for them. But that was like kind of, it wasn't excusable, but I could get past that. What I could not get past, I saw, I don't remember if it was 2 or 3. Either 2 or 3 people say that that specific doctor that I was going in to see, they had got infections, you guys. Infections. Not only did they get infections, they had to get rushed to the hospital. One of them specifically said that they kept calling the doctor saying, like, I don't feel right, like something's not right. And the doctor was brushing it off, not really answering or giving them the attention they needed. They were rushed to the hospital and had to get a corrective surgery, which ended up costing more than the initial surgery. And the doctor didn't even apologize or take ownership of it. After that, I was like, oh no. I'm good. I didn't tell my mom that, because I know I didn't want to hear like, oh, I told you. I didn't want to hear that, but that was that. So at the end of that, I was kind of sad. And I talked to my sister about it. And I was like, I wish I could just find, first of all, I really want a female doctor. But most importantly, I would love a black female doctor. So I was like, I really wish I could find that. Like, just, you know, venting to her. And she was like, I know one. Mind you, y'all, my sister is a surgical nurse. I don't know what. First of all, not only should she have told me this prior, but I definitely should have asked. She, at her previous hospital, she used to work and scrub in with a black female plastic surgeon. So she was giving me all the tea. She's like, go on her Instagram, look. And I'm like, oh, can you call her for me? Like, okay, y'all. So I looked at her page, I liked her work on her website and everything. So I called the next day to try to schedule a consultation. They were like, she's booked completely for consultations up until July 28th. And I'm like, July 28th? I'm trying to have my surgery early July. They were like, she's not booked for surgery in July. Like, she has availability for surgery in July, but she doesn't have availability for consultations. And I'm like, well, if I have to schedule a consultation to get the pricing and estimate and everything, how am I gonna book the surgery? So they were like, we'll call you if anything happens. So I'm DMing the lady. I sent out my paperwork. I'm DMing the lady. I'm like, please, just take me. I'm begging her at this point. So I don't get a response, nor is she opening my Instagram messages. I'm begging my sister to call her. My sister has her number because she used to work with her. My sister told me she didn't call her back. So I'm getting sick at this point, y'all, because I'm like, I really want this surgery soon. I'm sick. I'm like annoyed. But at the same time, I'm trying to remain optimistic. Asking my sister to continue to call her, do this, do that. So I DM'd her on her personal page prior. But yesterday I'm like, let me just DM her on her medical page. I DM'd her on her medical page and she still didn't open it. But like 5 minutes after I DM'd her medical page, the office called me and asked me if I wanted to come in for a consultation the next day, which is today. And I wanted to scream, y'all. I was too excited. Like, too excited. So that's where I am now, you guys. I'm very excited. This is like the most excited I've been for anything because I'm getting everything checked off of my list. 1, I'm getting an in-person consultation. 2, I'm getting a consultation from a female. 3, a black female. 4, a female that my sister can vouch for and my sister has worked with. So I feel like that kind of, even though I haven't met her in person, I've already established some kind of rapport because my sister has worked with her. Like, she gets extra points for that. I trust her. And my sister's like, okay, well, if you go to the hospital that she used to work at, I'm not going to name it, and get your surgery done there, I'm going to make sure that I get my nurse friends on your case. Like, I'm just feeling very comfortable, very optimistic. I'm excited to meet her. I think they're okay with me filming, but I'm excited for y'all to meet her too. I know I've been talking a lot, but right now literally the only thing that I need is for her vibe to be like on point. Like, if I get a good vibe and a good feeling from her, I'm sold. Like, I will put down my deposit today and get my surgery tomorrow. Shoot, I'll get my surgery in an hour if I can. Like, that's all I need. If her vibe is good, I feel comfortable with her, then I just feel like this is just fate. This is God's plan. So let's go inside. We're gonna meet her. I'm excited. We're gonna meet her together, and I'm gonna ask her, you know, all the questions that I have, and of course FaceTime my mama because my mama got questions too. I also forgot to mention that I'm really excited about this doctor because unlike the other places I visited and looked at, they're like butcher shops, and I don't want to go to a butcher shop. Like, I don't want to be seen by a doctor who's willing to do surgery on anybody, or a doctor who just wants to do surgery and go, like, cut and go. Like, this doctor, she is known for breast cancer reconstructive surgery, and doctors who are good for reconstructive surgery, they're really good because, you know, those are women who have had issues due to breast cancer with their breasts. So I'm excited, like, really excited. So let's go in, let's meet her. I gotta call my mom so my mom can ask questions. I have questions, but if all goes well, I'm putting down my deposit expeditiously. All right, you guys, they just finished taking pictures. It was very weird. Even though it was a woman, it was still weird. I don't know. But the doctor should be coming in soon. I just got the nurses who took the pictures and everything. The doctor should be coming in soon, so I think she's coming in now. Hi.
Hi, I'm Becky. How are you?
Okay, it's recording.
Okay. All right, so Simone Melzi, you met with my nurse. She told me that you're interested in breast reduction. Yes. So you're currently wear a 36 triple D bra.
Yes.
Okay. And it sounds like you're pretty healthy other than some asthma. You taking any meds for that routinely?
No. The last asthma attack I had was in elementary school. So.
Okay. And so you're pretty much asymptomatic from that now.
Right.
Okay. You're healthy. You're not really taking any regular medications other than vitamins, no allergies, and you're a non-smoker, correct?
Correct.
All right. Okay, perfect. So the easiest thing is, if it's okay with me, just to start with an examination.
Okay.
Have you always had healthy breasts?
Healthy meaning what?
Any lumps, bumps, cysts? Ever had to have a biopsy or a mammogram or an
No.
ultrasound? No. Have you ever had to see a breast specialist for any reason?
No.
Okay. Most people who are seeking a breast reduction, they are having some symptoms of neck pain and back pain. Is that something that you've been experiencing?
Yes.
Yeah. Okay. And is it something that you've seen your primary care doctor about?
Yes,
Yeah.
many times.
Okay. Did they ever prescribe you any medications, such as ibuprofen or stronger pain medicine to help you with the neck and back pain?
No.
No. Did they ever send you to physical therapy?
No.
No. What did they recommend to you when when you saw your specialist, your primary care specialist, with me, thinking surgery would be the...
Well, it's
Next
something
step.
I've been talking about for a long time. My primary care doctor is actually one of my mom's friends, and I've asked her to write it in my notes and just recommend that I get the surgery, and she's completely against surgery, so she refused to do it. So that's kind of the situation I've been in.
Yeah. Okay. So I'll start by saying, most breast reduction patients are some of our happiest patients.
Mm-hmm.
It is a procedure that has a very high satisfaction rate, and it's usually because of the fact that a good candidate, all the benefits of surgery massively outweigh the risks. So for a lot of people, the things that drive them to do breast reduction surgery is neck pain, back pain, difficulty maintaining their weight, exercising, the shape of their body in clothes, the fact that they feel that they look larger than they are, and their inability to sometimes participate in certain activities, whether it's wearing certain clothes without a bra, wearing certain bathing suits, or just physically doing certain sports that require 2-3 sports bras, things like that. It's just incompatible with the life that they are aspiring to live. So, if you're in any of those categories, then you definitely are probably a good candidate for a breast reduction. But the key is to say, well, what to expect? What's my downside? So that's what a lot of today's consultation is about, just telling you what to expect from surgery in terms of your long-term results, scar patterns and your risks, and then in terms of what to expect of the actual process of surgery day, how to prepare, and then that immediate post-op to get you to your final results.
Right.
Okay? So to tell you a little bit about the surgery, it's done as a same-day surgery, which means that you come into the hospital the same day that you go home. The surgery itself takes me about 2 hours, and you spend about 30 minutes or so going to sleep and a few hours recovering after the anesthesia. So you would need somebody to drive you home, obviously the day of surgery, but you will go home to your house, not stay in the hospital overnight. When I do the surgery, I typically don't use drainage tubes. The breast reduction does 3 things. It's going to make your breasts smaller. It lifts the breasts, and your enlarged and low nipple areola complex is reduced and put in the middle of the smaller lifted breast. Okay? Their scar pattern is like a lollipop shape, so around the nipple areola complex and then down to the crease with an extension in the fold. So it's almost like the shape of an anchor. I'll show you pictures of before and after.
Okay.
No 2 patients are the same, but it gives you an idea of what we can achieve and the aesthetics of what we do, and then the scar patterns and what to expect. Immediately after surgery, I use all absorbable stitches, so there's nothing for you to remove in the clinic, and everything is covered with a surgical tape, and you wake up in a surgical bra.
Oh, wow.
When you go home, I give you a combination of pain medicine and muscle relaxants. Okay? I normally see you in the clinic about a week after surgery. We check on the nipple and check on the incisions, make sure that the nipple's viable and there's no sign of infection. I normally see you again a week or 2 later. At that point, if the surgical tape is not full enough, we take it down and then we start a scar management regimen. We are worried in all patients about the risk of, thick or exaggerated scarring, but particularly in patients of color, we have a higher incidence of hypertrophic, which is thickened, or keloid, which is an overgrowing scar. So we do a combination of massage that you do at home. I teach you how to do it, silicone-based gels or strips, and then a close follow-up with steroid injections as required to help to modulate the scar formation and reduce the risk of unfavorable scars. Okay? For most people that work, what kind of work do you do?
I do social media work.
Social media. So you're predominantly working from a computer, office-based work?
Yes.
Immediately after surgery for that kind of work, you're probably going to need anywhere from 1 to 2 weeks break from work, although you may want to document your journey. So you'll be still working kind of from home, but what I mean in terms of any lifting over 6 pounds is a restriction. Going into the ocean, hot tub, swimming, anything like that is a restriction for at least 2 weeks. Normally when you're taking, narcotic pain medicine, you don't want to be driving a car or, going on camera. So until you're taking Tylenol, ibuprofen, and we can start to get all the restrictions off you in terms of activity, you're probably going to be 10 to 14 days. At that point, you'll be able to do everything but heavy lifting greater than 6 pounds. Most people in anything but a job that's labor intensive are normally back at work, 1 to 2 weeks after surgery. And then at 6 weeks after surgery, you could go get measured. You could wear any bra of your choice, any clothing of your choice. And then you could go back to the gym, Orange Theory, whatever you do to work out without any restrictions on lifting. Okay. The main risks of the surgery. The first one is there's a small risk of infection. Usually in people who are non-smokers and healthy, this is very low. We give you antibiotics on the day of surgery to mitigate your risk, but that's something that can happen. The other thing that we worry about is blood supply and sensation to the nipple. 100% of people have numbness of the nipple right after surgery because we have to cut around the nipple to lift it up and reduce it so the nerves are divided. 9 times out of 10, that sensation comes back within a year. 1 out of 10 patients, the sensation of the nipple is reduced on one or both sides a year after surgery and for the rest of your life. So that's one of the potential risks. The other thing we worry about is blood supply in women who have very, very long breasts, because the blood supply originates up by the collarbones. The longer your breast is, the further the distance that blood supply has to travel to keep that nipple alive when we fold and reshape the breast. In your case, you have large breasts, you're a good candidate for a breast reduction, but your nipple to notch distance is not alarmingly long. So it's something we have to be aware of. It's something we follow closely and check on. And we tell all patients, if when I see in surgery that I think the blood supply to the nipple areola complex looks like it's compromised, sometimes we take it off and put it on as a skin graft. And that's important to know for 2 reasons. One is if I do that, that nipple will definitely be numb. The other one is you wouldn't be able to breastfeed if that happens. And I probably do 200 to 300 breast surgery cases a year, and a combination of cosmetic, reconstructive breast and breast reductions. And I would say that in the last 4 years, I've never had to take in an unplanned way the nipple off. Usually you come in, and if you're really, really long, I tell you, I think we should approach it in that way. But in people that are like you, who I think you're going to be just fine, I tell you, you'll see it on the consent, and they have to make that decision in surgery. And I warn you and make sure you're okay with that. But I don't anticipate having to do it. It would be a unique situation, but you have to be okay with it if I feel like that's what I have to do to save the nipple. Okay? The other thing is scarring that we've talked about, and you've heard what the plan would be to try to reduce the risk of kind of exaggerated or over visible scars.
Right.
Okay? Immediately after surgery, all your neck pain and back pain goes away. It's like miraculous. Yeah, people are obsessed. And because it's suffering for a lot of women, like the back, the neck, it's just such a relief after a long day to take off your bra, that the thought that you just don't have that discomfort is just unimaginable. So it's amazing to wake up and it's gone. Of course, you exchange that for a little bit of incisional pain, but again, most patients, they take narcotics for a few days, if that. I do a block along all the incisions and on the chest wall during surgery, so you don't wake up in any pain. And then once you feel like you don't need your pain medicine anymore, you transition to Tylenol and ibuprofen. Okay? What else to tell you? So preoperatively, so the hospital does require you to get COVID screened. So they normally perform that test within, I think it's 72 hours of the surgery. The hospital will coordinate it. Once you have a surgical date, the hospital will coordinate that with you. I require you to see a primary care doctor to get clearance for surgery, and that specifically is them to make an assessment of your medical history, your heart and your lungs, and say you're healthy for general anesthesia. That's reviewed together with the anesthesiologist on the day of the surgery to make sure that you're not a high-risk candidate for anesthesia based on your history, I don't see that being an issue for you. And then the last thing I do request is a mammogram, which is an x-ray of the breasts to make sure the breasts are healthy, that there's no abnormal tissue in the breast before we make all these incisions and rearrange all this breast tissue. Okay, so you would get your prescriptions for all of those things today. The process of scheduling would involve, you know, you would pick a surgery day, coordinate it with my nurses. I typically book about 4 or 5 weeks out. So, you know, I know you had a time frame in mind, so she'll try to work you in where you want to go. You have to get the things done on your end in terms of the mammogram and the primary care appointments. So I would recommend once you get a date from her today that you call them right away to get those 2 things on the schedule.
Okay.
We submit to your insurance regarding permission for surgery. I think you're a good candidate in terms of your history and your exam. They do require us to submit a photo, an estimation of how much tissue we're going to remove, and then details such as your height and your weight. Some insurance companies require you to have failed medical management, which is why I was asking you the questions about what your primary care had sent you to do. Sometimes just having managed your weight and having worn specialist bras and they have not helped you is enough for the insurance company to deem you a good surgical candidate. Others sometimes make you fail other medical management, such as pain medicines and physical therapy for at least 3 months before they will approve it through the insurance. So in your case, we can go ahead and submit it and we'll see what the insurance says. And if the insurance was to say no, then you would have the option of to try to meet the criteria of the insurance, which may require some more time, or for you to decide if you just would prefer to pay it yourself and not go through insurance to get the surgery done in your timeline. Okay.
You guys, I am back from my consultation, and when I tell y'all God is so good, first of all, I freaking love her. Like, she is so dope. I love her energy. Like, y'all, I am 100% on board. A great sign I noticed from her is at the end of the consultation, I had 0 questions, you guys. 0, because she answered literally everything. For my previous consultations, I had to continuously ask and check up, but she answered questions I didn't even know I should ask. I didn't even have to bring up issues of keloid skin and scarring and stuff like that on women of color, because she addressed that, because she is a woman of color and she's done surgeries on women of color. And the other doctors who I've seen in person, they're first of all, they're men, and second of all, they are white men. So, and a lot of them they don't have many patients who are black. So I'm just excited. Another thing I really like about her is she makes it a requirement that all of her patients who are interested in a breast surgery receive a mammogram prior to their surgery. And I love that because she's very I'm just Team Yates. I love that because it just shows that she's not like a butcher shop. Like, she actually wants to promote women looking nice and feeling nice, but also their actual health. She cares about your health, and I love that. I'm super excited. I love that she gave me the process about insurance. A lot of the doctors who I even went to told me that they don't even work with insurance. So I love that her first instinct is to, let's try to get this covered under your insurance. If not, we'll figure out something else. And I love her. I've never had an experience like this with any other doctor. Even when I called my mom for my mom to speak to her personally, my mom was like, listen, my daughter vouched for you, which is my older sister who has worked with her in the past. My daughter vouched for you. I'm listening to you speak. And my mom is very like, y'all know how when your mama say if your mama don't like somebody, like, you need to cut them off because your mom knows best. Like, literally, my mom was like, I can tell you now that even if our insurance doesn't cover this, we're going with you, period. And I wanted to say period because that's how I felt too. Like, my mom was only on the phone with her for like less than 5 minutes, and my mom was sold because just her aura, her energy was just so good, and I'm excited. So, tentative date for surgery. We scheduled 2 dates. Not scheduled. We have 2 dates in mind. We have to go through the hospital to see which one the hospital approves of. And that's July 21st or 23rd. So I'm excited. My insurance should let me know within a couple of weeks whether or not they're gonna approve of me through the insurance. So let's cross our fingers, y'all, because that's $7,000, which I think she says it's around $7,000, which is the price out of pocket for the breast reduction. So that's $7,000 I don't have to pay. Well, I have a $1,000 deductible with my insurance, so that's what, $6,000 I don't have to pay. So I'm super excited. I'm thankful, and I'll be back and let y'all know what's going on with like my mammogram and all of that when I go get those. So
your shop, and yeah, you're paying $3,000 more, but that's your life you're dealing with.
And she makes it a requirement for me to go see my primary care. Like, she gave me all these, I don't know what this is even called. I had to see my primary care doctor, and I have to get a mammogram.
Yep, you're supposed to. Let me get water. Did you have water?
The other surgeons didn't even say that, Mom.
The other people are butcher shop.
Alright, bye y'all. Gotta go to work. Bloop.
With me, I'm a go-getter, baby, you can go with me. When I'm feeling down, I teach you how to hold on me. When I tell you pay attention, you gon' listen. You so submissive, and I like it like that. Do you wanna really go, baby, cause we might not come back.